Morphine IV push can help manage severe pain and pain associated with MI or pulmonary edema. Morphine binds to the opiate receptors to alter pain perception in response to painful stimuli. Administer morphine IV push undiluted at a rate of 2.5 to 15 milligrams over 5 minutes. Administer slowly because rapid administration can cause respiratory depression, hypotension, and circulatory collapse. If morphine overdose occurs, administer naloxone as an antidote to reverse respiratory depression and coma associated with opioids. Dosage varies with the patient's weight, age, rapid onset with a peak in 20 minutes and a duration lasting 4 to 5 hours. Most common symptoms include confusion, sedation, hypotension, constipation, and most important to watch out for is respiratory depression. Morphine is contraindicated in patients with respiratory depression and paralytic ileus. Make sure to do your assessments. Look for level of consciousness, blood pressure, pulse, respiration before and during administration. If respiratory rate is less than 10 per minute, assess for level of sedation and contact the HCP. You may need to physically stimulate your patient to prevent significant hypoventilation. Perform pain assessments prior to and at 20-minute peak after administration of morphine. Routinely assess bowel function and institute nursing care such as increasing fluid, bulk intake, and laxative use, if needed. Morphine can cause physical and psychological dependence and tolerance. Assess for risk for opioid addiction and abuse prior to administration. Remember to watch your morphine-sensitive patients more closely. Geriatric patients may experience side effects and respiratory depression more frequently, and pediatric patients may experience respiratory complications, excitability, restlessness more frequently. Teach your patients to change positions slow to prevent orthostatic hypotension. Assist with ambulation due to risk for drowsiness and dizziness. Morphine shouldn't be stopped without contacting the HCP due to risk for withdrawal. Prevent constipation with fluids, fiber, and ambulation if possible. If the patient is in bed for long periods of time, remind them to turn, cough, and deep breathe every 2 hours. Contact the HCP if pregnancy is planned, suspected, or if breastfeeding. Morphine IV push, a quicker way to manage pain.